Ani, Bojo, Wapsaquans Dijnakas, Magisi Dodem, Dokis Dinjaba, Anishinaabe, and Dao. Hi, it's Dr. Brenda Restoule. I'm Anishinaabe Kwe from Dokis First Nation and the Chief Executive Officer of First Peoples Wellness Circle. Thank you for having me here today to talk about Indigenous mental health. I'd like to acknowledge that I'm on the territory of Nipissing First Nation, and I'd also like to acknowledge the territory from which each of you are coming from today, living, playing, and working and enjoying life. They are all connected to a First Nation in your territory. As I said, I'm here to talk about Indigenous mental health, which is a very large, broad topic and larger than what I can talk about in 10 minutes. And I'd like to say that it includes Inuit, First Nations, and Métis, and I cannot speak to any realities and teachings beyond that which I know as a First Nations woman. So I'm going to talk to you from a First Nations mental health perspective. In our language, we don't have a word for mental health. Instead, what we talk about is Minoba Modswin, which means living a good life, and which can loosely translate, I guess, to wellness, or in the work that I do, mental wellness. Living a good life actually talks about being interconnected. Some of you know about the teachings of the medicine wheel and how living in balance or living a good life means we need to live well mentally, emotionally, physically, and spiritually, and it absolutely means that. But it also means recognizing that we are interconnected across creation, that we are interconnected to the plant life, the animal life, those that crawl, that are four-legged, those that are winged, living in the sky, those are in the water. We're connected to all of that. We're connected to the rocks, we're connected to the air, we're connected to sun, moon, stars, and all of those interconnected pieces are what helps us live a good life. Our interconnectedness is also connected to each other, to our families, to our communities, to our language, and to our culture. Interconnected teachings have taught us a lot. It has taught us, when we teach our young people about that if we did not have all of those things in creation, we would not be able to survive. We need them for clothing, for food, for shelter, for direction, as I mentioned earlier. And so if we were to lose one aspect of that, like water or clean air, that we would not be able to survive. But that it needs us the least. And so we must be the most humble and the most respectful, because we need all of those things to live. The teaching, one of my favorite teachings, is around the teaching of the tree and how it is so interconnected, not only in terms of what we see in front of us, what's around its, the birds and the animals and all those things that live in it and that pollinate it, and the air and the water, but when we go beneath the tree, underneath, we see its roots and its connectedness to the roots of other trees, not just its tree, like if it's a maple tree, not just a maple tree, but all trees, and then all things in the earth, the flowers, the plants, the fauna, the flora, and all of those roots interconnect and make their way to the water, and they nourish each other, and so they take care of each other. And so that's just a really good teaching about mental wellness, or about wellness, is how we must take care of each other. And I think when we look at this time during COVID, we are definitely learning about interconnectedness. We've learned that virus that has started somewhere across the globe has spread across the globe and has had impacts that have reverberated for all of us. And so we think about interconnectedness sometimes in a negative way in this example, but it also teaches us about the positive parts of interconnectedness, those public health measures around staying home and staying safe and protecting others. That is one message of interconnectedness, and how when we stay home, we're taking care of our neighbors, not only ourselves and our family, but our neighbors and our community at large. It also has taught us that what we, from a public health measuring, be careful what you touch, because you don't know who touched it and what it has on it, and it can give you sickness. So that's from a very negative point of view. But from a positive point of view, it has taught us that if we take care and are gentle and kind in what we touch and what we think and what we say and how we treat each other, we can nourish each other. We can take care of each other. So, making sure that we're helping each other as best we can. The work I do from that I've been mandated to do for so long has come from the First Nations Mental Wellness Continuum Framework. And this framework is based on the voice of First Nations people and has been promoted and supported by some of my partners, like the Thunderbird Partnership Foundation and the Assembly of First Nations and the First Nations and Inuit Health Branch of Indigenous Services Canada. And this framework that you see here, this is the First Nations Mental Wellness Continuum Framework. It's a very interconnected and complex model that I'm not going to talk about, but I just want to highlight culture as a foundation. This piece here is really critical. It talks about how culture is a significant and foundational piece to our mental wellness. Why is it foundational? Well, it teaches us a lot. It teaches us about our language, and within our language is all of the teachings to living a good life. It teaches us about connection to our identity in terms of who we are as a person today, but how we've come to be this person. So it teaches us about our interconnectedness to those who come behind us, our ancestors who paved the way for where we live today, and about what we do and how we live life interconnects us to those around us now, but also to the 7 generations ahead, those yet to be born. So it teaches us about that. Our culture connects us to our knowledge and our evidence and our teachings, some of them that I've referenced here, like the medicine wheel, but all kinds of teachings about how to live a good life and about who we are and why we are important and how we contribute to the wellness of our community and of our family and of creation. So those are all really important pieces. Culture as foundation, though, also speaks to recognizing that the social determinants of health all play a part in our mental wellness, and that is definitely a piece of our framework here. It also tells us things around things like the importance of partnerships and collaboration as being critical to our mental wellness, and I'll mention that in a minute. So they're all important. One of the bigger pieces it also talks about in the framework is the importance of collectivity and how, as First Nations people, we are we think collectively, we think as nations and as families. So think about not only our immediate family, but our extended family, our community family, our clan families. So it talks about all of those kinds of collective thinking. So for us as First Nations people, when we think about that, there's been many challenges for us. We have higher rates of mental health problems like anxiety and depression, higher rates of substance misuse, higher rates of chronic health problems, higher rates of social health problems. But it also tells us from a collective point of view how we can take care of each other and how we can address these negative impacts to each other. And so that's a little bit about what this framework talks about. And so during COVID-19, we have looked at this messaging and recognized that we think more collectively. Some of the messaging has been challenging for us. So thinking about messaging around things like physical distancing is difficult because we live in overcrowded housing. So to do that is really challenging. Thinking about washing our hands several times for 20 seconds is also really difficult for our communities who don't have access to clean drinking water. That is really difficult to do. And asking them to use water, which is a real precious resource, is hard to imagine doing. Thinking about social distancing when it was a language that was used was really difficult because we tend to celebrate we are social people and tend to celebrate things from birth to death. So to not be able to come together to help people in celebrating is really challenging. And so the messaging hasn't always resonated with us. Even thinking about 2 meters apart, some youth have said to us, why don't we use messaging like, standing 1 moose length apart or 2 fishing rod lengths apart as a way to think about messaging. So thinking about how we change our messaging, but But our leaders have heard that if we're thinking, because we are collective and those are challenges, we have to take extraordinary measures in a way to ensure the health and wellness of our people, because should COVID come into our communities, it could be devastating for us, absolutely devastating. And so some communities have locked down their communities. And for some, that has led to experiences of racism by the non-Indigenous communities around, who don't understand why they're doing that and wish to have access to some of the commodities in the First Nations. But they're doing it to protect their citizens, the vulnerable ones, those, the young and the old, and all of those in between. And our people are working really hard for that. But in lockdown, it has also triggered us. It has triggered those increased feelings of marginalization, increased feelings of isolation, things that we have experienced as part of colonialism and colonial acts. And lockdown has meant that there's been a real really watching who comes and goes from the community, and that they need permission to do so. And it has reminded some of our people about the reserve pass system, who in the prior to the 1950s, people needed a pass to actually come and go from a community, and that came from the government. And so those kinds of measures, although meant to keep people safe and protected, has kind of increased and triggered people's trauma. And so our rates of anxiety and depression and fear are heightened as a result of that. And so we're seeing those higher rates of mental health challenges and higher rates of poor coping, substance misuse and alcohol use and things like violence. But one of the beauties about us is our culture. And in our culture, we are talking about our strengths of our people, our resilience, and the lockdowns are meant to be about strengths. And so our communities have used lockdowns to bring our people together. And so they have put in programs like food security programs to care for all members of the community to have access to good, healthy foods, so that they don't have to go into the communities. And not just those in lockdown, but many communities are bringing in food and feeding their community members as a way to keep them safe, so they don't have to go to the urban centers where they might be at risk of contracting COVID and or bringing it back into the community. They have also gone and started to use wellness checks, so calling sometimes all people in the community or those who are more isolated and vulnerable as a way to ensure that they're safe and they're well. Many have used technology such as this to bring out language classes, to have our knowledge keepers and our elders come and give teachings on how to use traditional medicines to boost your immunity, how to deal with respiratory illnesses, teachings on the springtime, on the importance of like the bear teaching and how the bear and hibernating means the importance of being still and being quiet and taking care of oneself and boosting your immune system and giving space and time for the rest of creation to also rejuvenate, which is what we are seeing in this time of COVID. We see that the air is cleaner, the water is cleaner, and animals and plants are flourishing while we have quieted down. And I've seen on social media, many people say that they like this time. They've liked the time to be quiet, to do the things they haven't been able to do, to reconnect with family, to be able to connect and give those teachings to their children. And so it's a precious, precious time during COVID as well. It's not all been about fear and worry, although for some it has been. So for us as First Nations people during this time, promoting and supporting our mental wellness has been about reconnecting to family, reconnecting to our language, reconnecting to the teachings and to the evidence, and to rejoicing and celebrating the collective efforts to protect ourselves and keep each other safe. And so during this day, I encourage all of you to think about how you are interconnected to all of those things around you, all of those people around you, how you can manage and support your own mental wellness. Some of us do that through prayer, through smudging, through sharing of meals and laughter. Take the time that you need to find those things that bring you joy and find good mental wellness. So bama pi, miigwech for this time.